Okay, dear, I'll start at 10 a.m.
So, hello everyone.
Yes.
Hello everyone. Yeah, this is Mohamed Zaafarani, and it's my pleasure to join you today in a new webinar about shaping. Thanks, Fanta, for the invitation, and I hope you'll enjoy our session today, talking about the AF-F1 Essential Kit done by 𝗬𝗲 Endodontics in cooperation with Fanta Dental. So, let me share my presentation and my slides. Okay. So the title of our presentation today is 𝗬𝗲 Endodontics Essential Kit, Essential Tools for Exceptional Shaping. Actually, we were working with Fanta Dental since long time, almost more than 10 years. And since that time, we experienced great products in terms of quality and consistency also, and in terms of precision. They have many file systems with different properties and different cross sections, like F3, F1, reciprocating systems also are there. The F1 is a great file system, was an invention in the cross section. So first was introduced as single file system that you can use it for preparing the canal and shaping the canal. It has superior cutting efficiency and has a unique flat side design. Thanks, Fanta, for the innovations. And in 2020, 𝗬𝗲 Endodontics decided to have their own system designed by our team from 𝗬𝗲 Endodontics in cooperation with Fanta Dental. And we chose the F1. The F1 file is a great system produced by Fanta Dental. So we in 𝗬𝗲 Endodontics, when we decided to choose a file system to be representing us in the dental field or in endodontics, we choose the F1. And now I will show you why we choose the F1 from Fanta Dental. Our kit is called the Essential Kit or Essential Files. This system, in my opinion, is a great system to have in your clinic. It will help you to manage easy cases, moderate cases, and difficult cases, as we will see together today. First of all, the file system has a flat side design or flat surface design, and that was an invention or new design introduced to dental market. And this way, we can say that we are imagining the file-canal relations or interaction. As we have a flat side design, so we have reduced surface contact with the canal walls, and this side or this flat side will give more spaces for dentine chips to accumulate, so it would maintain the file or our file to it would maintain our file to cut effectively along the instrumentation procedure because we have too much of shape space. Also, with the flat surface design, we can appreciate the advantage of allowing irrigation or irrigant solution to flow more freely around the file. That would also enhance debris removal and moving the debris toward the pulp chamber. And this would result in a superior canal debridement and preparation quality. With the same design, we have also superior cutting efficiency thanks to the flat surface design and the dual cutting points. We have only two dual cutting points that would minimize the mechanical stresses of the file on the file. So it would let the file cut effectively and also at the same time decrease stresses on the file because of the dual cutting points. We call that design the vertical plate technology. With the flat surface design, if you hold the file, you can appreciate that the flutes is like vertically designed. So during the instrumentation, it moves the debris pronely. And anyone who experienced the use of the system before, for sure, he would have seen the moving of debris toward the pulp chamber. And with a flat design, which is like shallow cut in the metal core, it enhances the flexibility without any compromise in the cutting efficiency, because we have less metal core. Because of the flat design, we have less metal core, so our file is more flexible, not too much metal in the cross section, so our files are more flexible, and it would perform better, especially in case of curvy canal or multiplanar curvature, as we will see together in the upcoming cases. Here in this study, it was discussing the role of flat design surface in improving cyclic fatigue resistance of endodontic nickel titanium rotary instruments. And it was done by great authors like Gianluca Gambrini, Marco Sarcinelli, and many other great authors. So they showed in this article or research that the reduction of the mass production in endodontic instruments, like decreasing the metal amount because of the flat surface design, improve the resistance to flexural fatigue due to the major flexibility that we have with this design because of reduction of the mass. And when compared with other files without that design, no, the files with a flat design perform better in terms of resistance to flexural fatigue. And as we know that during manufacturing, heat treatment would improve the properties of our files in terms of flexibility, thanks to heat treatment and thanks to the variable heat treatment that allow companies to control the properties and performance of the file. So the AFF1 made of AFR alloy or heat treated at the AFR temperature. So it is mildly martensitic. It is not that so soft because already the file can already have flexibility because of the flat surface design and less metal core. So no need to have it highly martensitic or too much flexible. It's already have some sort of flexibility. So to make it mildly martensitic is really too good and excellent in the design. So to choose the temperature that control the file behavior based on the cross section and design of the file was a smart idea to have the file treated at the AFR temperature. So I'll show you now how this would affect the performance of the file, especially the difference from the 1303 size file, the mechanical glide path, and the larger size files when we open the box of the root canal, the file system. Also, our files, the F1 has a non-cutting safe tip, and this is great advantage to have in our system because that would reduce errors and mishaps that could happen during instrumentation, especially with beginners who still don't develop the tactile sensation. Sometimes they put force on their files, they push the files. So the file should have some sort of forgiveness. So being a non-cutting safe tip that would forgive any extra pressure or any force that we should avoid during instrumentation. And this way, we will reduce the incidence of iatrogenic errors like perforations, canal transportation, and zipping. One more advantage of having a safe tip, non-cutting safe tip, is the centrality of the preparation. In this article that was discussing the challenges during endodontic treatment, especially the canal centering ability, it showed that files with asymmetric cross-section perform better in terms of centering the preparation compared to files with symmetric cross-section. So here, they concluded that an instrument with non-cutting tips shows better canal centering ability. And also when they have an asymmetric cross-section, that would also improve the centrality of the preparation. Now I will show you what we have already in the essential kit. Here's the box. It's a very nice box in the design. I like it. So when you open the box, inside you'll find a guide. It shows you how can you change the sequence to manage different cases scenarios, from difficult to easy, medium, or wide cases, narrow and difficult. So it's like a course, small course inside. Inside the box, you have 10 manual file, 13 taper 3, 2004, 2506 as the file for apical finishing, and 3504 for finishing of large canals. Let's check the files together. Here's 1303. This file is already flexible by size. It's a slim file, so it's flexible by size. That's why if you try to pre-curve the file, because it's already heat treated, it has a shape memory effect, and it's fine and it's needed in that sizes. Small size file should not be treated by heat treatment to be very flexible. No, we need some sort of stiffness to be able to penetrate, especially in initial phase of shaping. Moving to larger size files, here we can appreciate the AFR heat treatment. Now our files are control memory. They are flexible, and this is needed for the phases we are using the file for, like mid-root shaping or even apical finishing. And here the 3504, again, it's controlled memory, very flexible. So the behavior of this file would maintain the shape of the canal. It won't change the shape of the canal. It would maintain the geometry. So 1303 as a mechanical glide path file, we can use it also for pre-flaring, especially in narrow canals. When it comes to canal like MP2 or calcified canals, very narrow canals, I would avoid the use of pre-flaring files, or commonly used pre-flaring files like an orifice opener or larger taper file. But I would go first with the mechanical glide path file, one like 1303. For me, this is the best mechanical glide path file. I've tried many files from different companies, from different systems. This one is really different. Having a flat side, in initial phase of shaping, no much engagement in the canal, especially in these narrow and challenging situations. We need this kind of smart designs to be able to negotiate the narrow canals safely without mistakes. And I'll show you cases to prove my statement. So 1303 could be used as a pre-flaring file for narrow canals and tight entrances like MP2, and for sure as a mechanical glide path file. 2004 could be used also for the same purpose as a pre-flaring, as a mechanical glide path file in larger canal, and also it could be used as a finishing file in very narrow canals. And here I want to discuss with you a very important point. To which size should we end our preparation? Actually, there is no agreement about the minimum size of canal or the canal master apical file, but most of the studies support the enlargement up to 3004 or 2506. But when it comes to severely curved canals or multi-planar curvature canals, it would be very, very challenging to enlarge the canal to these certain sizes. So sometimes we would end our preparation to smaller sizes, like 2004, maybe 2504 also is fine, not to risk our procedure to file separation or canal straightening or even perforations. So we end our operation to 2004, it's fine, and we can pay more attention to irrigation and canal disinfection. So this is regarding 2004 as a mechanical glide bath file in regular canals and as a finishing file in very, very narrow canals or multi-branch curvature. 2506, I love to use it as a brief learning file instead of the orifice opener. For me, if I'm using the essential kit, it's fine to use 2506 as an orifice opener, and I'll show you also cases showing how it performs as a brief learning file. And also, we can use it as a finishing file in regular cases, an apical finishing size, because with this size, 2506, we can make sure that our irrigation will be delivered well to the apical portion of the canal. 3504 is a nice file to have in the kit because sometimes we have large canals like palatal canal, maxillary molars, distal canal, lower molars, upper anterior, young age patient with wide patent canals. So sometimes we need large files. 3504 is fine to be used in that situations as an apical finishing file. So let's move to some clinical cases, and I'll show you in details how is the performance of the files. The F1 from the essential kit was different sequences, how we were able to manage these difficulties. So here, after opening the access, irrigation, because we can't use file in the right canal, here I'm starting by 2506. And here we can appreciate how the file is moving debris toward the bulb chamber. So starting by brief layering only for the coronal portion, no need to take it deep down to the apex. Here in the palatal canal, also brief layering. And as our file is bendable, so we can use it in cases with limited accessibility. Brief layering the mesobuccal canal. Mechanical glide path using 1303 to full length. File is moving safely towards the apex. Same for the main mesobuccal canal. Now our irrigation needle can penetrate deeper inside the root canal, enlarging to 2004. Again to full length. Pre-bendability, a great advantage in cases with limited mouth opening or poor accessibility. Here in the mesobuccal to full length also. Good irrigation, you need also to make sure that you have good flow of the irrigant from irrigation needle. Now, 2506, add an apical finishing file in mesobuccal and distal buccal canals. Because with this size, we can make sure that our irrigation will be delivered well to the apical portion of the canal, and also to allow for irrigation displacement. And here, 3504 for the large canals. Now, activation was ultrasonic. Here's the Actor Eye Pro, the ultrasonic cordless device for activation in mesobuccal. Just take care not to take it beyond the canal curvature. It should be limited only to the straight portion of the canal. And here in the palatal canal, now our canal system is cleaned. And here's the case after obturation. And this is a post-operative radiograph. Great respect to canal shaping. Also, it's conservative. And here you can see that the buccal canal is shaped with 2506, the palatal canal 3504. So great result, thanks to the great design of AFF1 from the essential kit. Here's another case which was referred to me because of blockage in the nasal root. The previous operator was not able to detect the canal entrance, so he referred the case. And under magnification, here we can see that dark areas showing the possible entrance of the canal thanks to ultrasonics and microscopic endodontics. So we can easily detect canal entrances. After that, shaping would be easy. Here also the same. I used 1303 for managing these difficult cases. I told you that for narrow canals, it's better to start with the mechanical glide path file rather than starting with a large 2506 in the start. Now we established the mechanical glide path. One of the great files to use, 1303 from the F1. And now enlarging the canal and the apical finishing by 2506. Here you can see how much of debris coming along the file between flutes, thanks to the flat surface design, too much of a space to collect debris from inside the canal, maintaining good cutting efficiency during canal shaping. After that, we can follow with obturation using bioceramic sealer. And distal was confluence. These canals were confluent, so they have a big isthmus in between. And here's the case after obturation. Very important to notice how we're able to maintain the canal anatomy. Even for small curvatures or a small radius of curvatures in the canal, we were able to maintain it without any change in the canal geometry. One of the most difficult cases was severe curvature, narrow canals, also that was shaped by F1 essential kit. And here I'll show you the sequence that I used in that case, starting by 2506 for pre-flaring, followed by size 10 manual file for manual glide path, 1303, 2004, shorter of the working length, followed by size 10, so 4 lengths, then 1303, 2004 for apical finishing. And here, I didn't enlarge the canal more than that size. We can't enlarge in that case for larger sizes because it would be more risky. So better safe than sorry. And here's a case after 1 year follow-up, great result. Periapical status are good, no periapical lesions or any kind of radiolucency. Another case that was shaped with a single file system, the 2506 from the essential kit. Here I'll show you how we manage it after removing the old temporary filling. Modifying the axis for gaining straight path to the canal entrance. Ultrasonic for cleaning isthmuses. And here we are removing large pulp stone from the pulp chamber. Again, ultrasonics for refinement. For sure, when we use ultrasonic, we start in dry field, so we have good visibility to the operating field. Then we can open colon to flush away debris to improve visualization to operating fields. followed by 2506. I used it for pre-flaring. Then for mid-root shaping and apical finishing, and here I'm activating with ultrasonics. And after obturation, providing immediate seal is very important for better treatment outcome. And here dual cure composite resin. And here's the case again after obturation, green shapes using single file 2506, but for sure not in one shot to the full lens. This is a great case that I really appreciate my work in. It was very, very difficult. Here I'm showing you removing all the restorations. Patient came symptomatic, severe pain, not able to sleep. And here I'm showing you this material was there for more than 5 years. And you can see that it didn't set. And here, the exposure, exposed, necrotic pulp, opening the axis. Again, large pulp stone. That's why we need to use ultrasonics to make it more easy to remove. Cleaning the isthmuses. Here. Removing, yeah, it's clear here is a calcification and calcified pulp tissue in the bulbar chamber. Then open coolant to flush away debris from the bulbar chamber. So for me, it was easy to locate the distal buccal canal, the palatal, and the main mesobuccal. But we know that the percentage of MB2 in maxillary molars is very high. That's why we need to try to look for following isthmuses and any guide in the floor, like the floor map. So with ultrasonics, for me, it's the best tool to try to locate the canal like MB2 because of it's very precise in cutting and we have too much of control and also vision. But I couldn't find it. It was difficult to find. So I decided to shape the other canals first, starting by pre-flaring using 2506 from the essential kit, only to the coronal portion. And here you can see how much of debris coming from the canal, what tissue coming from inside to the bulbar chamber to be easily removed. Now, better delivery to irrigation inside. And here, pre-flaring to the mesiobuccal canal. Don't push the file. Don't push the file at this stage. Still, you're not sure about the patency of the canal. Pre-flaring, passive, followed by the mechanical glide path using 1303 to full length. And in the palatal, for sure, it's easy, 2004. The length of the canals was 21 in the buccal, or 22 in the buccals, 21 in the palatal canal. Now 2004 for the mesiobuccal canal. So it's an easy sequence to follow in most of cases. Irrigation. For the palatal canal, I would shape to 3504 because it is wide and large. Also, straight canal. Can you appreciate how much of debris coming from inside to outside, thanks to the flat surface, too much of space to collect debris and move it toward the bulbar chamber, thanks to the vertical blade design. And here 2506 to the palatal. deeper delivery to the irrigation. Now 3504, and after finishing shaping to all the canals, I started to look again for MB2 because I can see like tiny or very, very narrow isthmus. So I can't ignore. And here I'm shaping the MB2, which was narrow, which I was not able to locate using the 1303. I told you it's a great file to use in these narrow antennae canals. But for me, if I'm using in a difficult situation like this, I would use it in single time. I will not use it again because it's already exposed to too much of stress. And here's the case after completing shaping. MP1, MP2, again, they are confluent. So injecting sealer into the mesobuccal and MB2, you can see that sealer is moving already from the MB1. Here's the distobuccal and the palatal canal. Take care during injection of sealer inside the canals because you need to have your needle tip free, not locked inside the canal to avoid over extrusion of the filling material. And here's the case after obturation. Great shapes. I really appreciate how the respect to the root canal anatomy. Here, small curvature, the apical third of distal root. For in the palatal root is the same. And here's the MB1 and MB2. And you can see that in the same case, we have three different master apical files. So for the palatal canal, it was 3504, which is already large. Mesobuccal and distobuccal, 2506 or taper 6, because they are regular canal. And for the small, teeny canal like MB2, I just shaped to 2004, also to avoid over instrumentation or over reduction. It's particularly in that part, we have thin dentine thickness. So we need to avoid also the stripping perforations. Lastly, regarding the use of 1303, here are two cases. MB2 going directly with a 1303 for mechanical glide path. Great file. You can see here how the file is quite stiff. Yeah, it's still flexible. It's flexible because of the size. And here is another case for the middle mesial canal, which also is narrow and tight. I'm going directly with the 1303. Great file. I love it. So both cases, I am preparing using the mechanical glide path file. 1303 is exclusive in essential kit. It's not available from F1, only with essential kit. We have also 1303 in the rising system, but not with the flat design. It's also a great file, but I like more the F1 design for the mechanical glide path file, and here for the middle mesial canal. So this way, I showed you the properties and how the F1 essential kit files perform in easy and regular difficult cases, and how the 1303 perform in very narrow canals. Great file, you need to try it. So it was great cooperation, developing special kit, the essential kit, from the team of Endodontics in cooperation with Fanta Dental. Thanks Fanta Dental for the quality, the consistency, and precision. And thanks everyone who attended this webinar, and looking forward to see you again in another session, maybe talking about another system, introducing another system, or more techniques. So thank you and see you soon. Bye-bye.
Okay, thank you so much for Dr. Zaafarani for giving us the wonderful course, and see you next time.
Thank you.
Okay, dear.